Hello, and welcome to another episode of Faces of Phyla, where we talk about phage technology and acne. My name is Yug. I'm your host. I'm the founder of Phyla, and I'm passionate about phage technology. I've been following the field for 20 years. My background is I'm a scientist, and after spending more than a decade in academia, I decided to start a startup focused on phage technology and acne. Today, I am joined by Savanna Perry, and I'm so happy to introduce her to you. She is a certified dermatology PA who graduated from Augusta University, and she specializes in the treatment of acne and rosacea. In addition to her role as PA, Savanna also advocates for the PA profession, and she has developed a really useful program called the PA Platform that helps aspiring PAs train and be coached towards the next step in their professional ladder. I'm so happy to welcome Savanna to the podcast. How are you doing, Savanna?
Doing well. Thank you for having me.
Yeah, I'm really excited to have you because I know you've got a lot of experience with acne, and it's really interesting to hear from a provider who's now had some experience with Phyla as well. So let me ask you first up, your practice focuses on acne treatments. Can you tell me what are some of the tools in your toolbox and how you apply them?
Yeah, I really enjoyed treating acne. I've been a dermatology PA now for 11 years. And so in that time, we've seen a few new things come and go, but a lot of our tools remain the same. When I explain it to patients, I'm kind of like, all right, here are our options. We have some over-the-counter options. We have prescription options. Those are medications. They can be washes, creams, pills. There's a good variety of options, but a lot of them are kind of the same active ingredients, just in different packages. And my approach to acne is figuring out what is going to work best for not only that patient's skin, but also their lifestyle, their routine. What are they actually going to use and what are they going to tolerate? So it's not just the medications, it's also the vehicles that we're looking at when it comes to kind of the tools we're using.
That's really interesting. So, you spoke about fitting the right solution to the right problem, right? To their lifestyle and to their needs. So what are you hearing from the patients? They come to you with acne, obviously, but what are their additional concerns? I mean, to tell me, like, is there a big concern about sensitive skin or about side effects? What are you hearing?
Yeah, sensitive skin is a big one. And not wanting anything that will make their breakouts worse, or make them flare. I think beyond that, the other thing I hear a lot, and even just thinking about this week, is overwhelm. There's so much out there, so I just don't do anything because I don't know what to do. I don't know where to start. I don't even know what to wash my face with. And so we kind of back up a few steps to ground zero of like, okay, what are you using now? What bothers you the most? What are we trying to get to? And setting those expectations and getting a feel for, I'm a busy mom. I have 2 kids. Sometimes I'm not washing my face twice a day. True confessions, like sometimes it just doesn't happen. And so having those conversations of, are you going to wash your face twice a day? Is it only going to happen once a day? If I give you something to put on, how often can that happen? And for some patients, they need a very specific routine and system to stick with. And so a lot of our approach is patient education of, this is a product I'm recommending. This is why I'm recommending it. This is how long we're going to give it. And then I want to check you back. If it's not working, we might tweak it in this way. I really want patients to feel empowered to be part of their treatment. So I don't want to just be dictating, hey, this is what you have to do or should do. It's more of, hey, these are the options. This is why I'm recommending this. But if you don't agree with that, let's talk about some other things. And I want them to tell me what it is they're looking for.
Yeah. And sometimes patients come to you probably having tried everything and are looking for something new, and it's tough to offer them something new when you have a limited toolbox. And I think this is where phage technology can have a big impact. As you know, phages target, or their approach to acne is that they kill the C. acnes bacteria that overgrows on our skin and causes inflammation. And by putting that C. acnes bacteria in check and reducing it beyond an inflammatory threshold without harming the good beneficial bacteria on your skin, it's a very targeted, very sophisticated approach to acne that we haven't had before, not just with phages, but with any other modality. So what do you see as kind of some of the benefits of this approach, as it, there's a science piece of it, but then how does it impact the patients as well?
Yeah, I think the phage technology and what Phyla offers is something that the field of dermatology has been looking for. I've heard since I started at conferences and in articles, these discussions about the microbiome and about how we should be looking at that and we should be targeting that. Unfortunately, acne is one of the things that I think gets put on the back burner sometimes because it doesn't get as much attention with time and research and dollars as some of our other skin conditions. So there really hasn't been that focus, even though people have said, yeah, this is a really, a good area that could be revolutionary in acne, and just no one has taken it on until you guys. So the microbiome, which to patients, a lot of what I'm hearing is skin barrier. I feel like I've damaged my skin barrier. I don't have a good skin barrier. So we talk a lot about what that actually means to have a healthy skin barrier. And that's where I think phages come in, just for that approach that while there are different, quote, causes of acne, yes, if we can target one of those in a way that's also gentle, because we can kill the bacteria, but it's not always in a way that is kind to the skin. And that's where then we're having to counteract this irritation and this dryness. We don't want to fix a problem and cause another one if we can help it. So being able to say we have this option that is great for sensitive skin, but also effective, is a really big game changer. And that's where the phage technology, to me, kind of fits in for those patients who want something that's just a little bit more gentle, but also they're going to see results with.
And how does this approach compare to traditional approaches to acne, whether you're talking about benzoyl peroxide, antibiotics, retinoids?
Yeah, I think for some patients, it's more of a direction they need to go, where they maybe can't tolerate some of our other actives, but they just need something a little bit different. Sometimes I'll explain to patients that every once in a while, somebody's a wild card. Like, just the things that I think would work don't. And I don't necessarily have a reason for that. But I'm like, we got to get creative here. We got to try something different. So I think for those patients who either have tried everything, feel like they've tried everything, feel like at home they have the entire skincare aisle on their counter and are still not seeing what they want, they need to try something different. And they need to take a step back. And sometimes that's just simplifying and not having a 12-step routine or system or anything like that. Like, let's just simplify things. Let's go with something, a 3-step system, a cleanser, a moisturizer, an active, and get things calmed down. And then if you want to maybe try adding stuff back in, you can. So I think there's a place for phage technology and Phyla like by itself, but then I think there's also combo therapy that some patients might need. And that's where acne treatment is so individualized. And sometimes it can just feel so overwhelming and like there's so much out there. But taking it the simple route, kind of going back to basics, kind of taking out the overcomplication of it can actually make the biggest difference sometimes.
And how does Phyla fit into your practice?
Yeah, so I think we have a lot of patients who, again, are looking for simple, cost effective. That's a big part of it as well, is we want something that isn't, I don't think people should be spending crazy amounts. I've had patients come and say, I'm using this $400 cream and it's not working. And that's mind blowing to me. I'm like, where do you find a $400 cream? And it's not even a prescription. So I think, looking at all of the things, Phyla to me is a great option for that patient who feels like they haven't gotten the result they've wanted with things they've tried, or someone who says, my skin can't tolerate anything. I'm using these gentle cleansers and it's like, I'm still irritated. I'm still flared up. I think right now we're talking about phage technology for acne, but this is another area. We're talking about this in other areas in skincare as well. Things like eczema, we're talking about skin barrier. We're talking about just making sure that skin is healthy and how do we get that back? So I think, I haven't tried in other areas, but now I'm like, maybe I should be. But for that acne patient who just needs a system, needs something simple, I think that's a great person for it. Anecdotally, I was sharing that I gave it to a medical assistant in our practice, and she was someone who had tried everything and she couldn't tolerate really any of the prescriptions in the sample closet, would use them for a couple days and then be sending me a picture and a text message about how terrible her face was. And she's had a great experience. Her acne's clear, even going to school and being completely stressed out. And she has not complained once about being able to tolerate it compared to so many other things that we had tried. And so I think, I take these anecdotes and I think about the patients in my practice. And when they come in, I'm hearing those similar stories. And those are the ones I can be like, okay, this is a great fit for you. And here's why I'm recommending it.
Yeah. And, you mentioned the kind of how gentle phages and Phyla can be on the skin. And really what we're doing from a technological standpoint is we know that phages, specifically these phages that we use in Phyla, but these phages are abundant on healthy skin, but they're actually deficient on acne skin. So naturally, there's, I think 85% of us are walking around and being affected by acne at some point in our lives. And then there's 15% who kind of magically skate by life, never really being affected by acne. And we've always thought, oh, what is it about them? And we didn't really know. And so this could be one of the big reasons why some people just don't get acne. Their skin is resilient to it, and it just never occurs to them. It's because they have a very high natural concentration of phages. And so what we're trying to do is we're trying to supplement phages into people's microbiome so that it balances out their microbiome, but it also helps the phage to kind of be present over the long term. And I wanted to ask, you've got your phages, I think, which is a very interesting technology, but it's just one of many microbiome therapeutics in skincare and in acne. And I know, there's been a lot of interest in the microbiome for, I think, over a decade now, both in the gut science part, but also in skin science. Are you aware of any other microbiome technologies or microbiome therapeutics that are available, that are in products or that are exciting to you?
Not in the same way as Phyla. There was, for a period of time, we had a prescription of like a hypochlorous acid spray, and that's been something that's kind of been played around a little bit, but I don't think, I never saw it as something that actively helped or made a difference in patients. It is something I'll still occasionally recommend for an eczema patient, but in acne, it didn't quite make as much of an impact as we wanted. And so, yeah, other than that, I really haven't. Again, it's just been something that people talk about. Like you said, the gut, they're like, we're seeing these changes in the gut. We can use it there, but no one has really translated that to the skin as much as I would have expected them to. And it's just, I think I appreciate how targeted Phyla is and how it is specific to skin and acne and really just trying to get to that cause without causing damage.
Yeah, that's true. And I think obviously a lot of attention has been paid on gut diseases and the microbiome, and less attention has been paid to the skin. And my hope is that as this part of the industry matures, that there's going to be products coming out for the skin that are microbiome focused as well. Obviously acne is a chronic condition. It's a long-term condition. It can affect you for months or years. What is your view on sort of the long-term management of acne, and how do you see Phyla fitting in?
Yeah, acne, that's one of the tough things because it really can just kill somebody's confidence. And, I am lucky in that I get to see people that are improving and, see that confidence grow and see how they're feeling better about themselves, because it is so visual. But it is chronic. It is a long-term thing. Yes, some people grow out of it. Some teenagers will deal with acne and grow out of it, but I'm still seeing young adults. I'm seeing people in college. I'm seeing women, especially adult women, still dealing with acne throughout their lifetime. So my approach is, once I get someone on something that is working for them, I educate on, when you're doing well is not the time to stop. That's the time to keep doing your routine as regularly as possible. And another thing I educate on when I see a patient is, let's say I'm seeing them for acne for the first time, I usually make the statement of, I'm not trying to get rid of what I see today. These breakouts you have are here, but I'm trying to prevent the next one. Mm-hmm. I don't want new bumps like this. I don't want new breakouts like this to happen. And so then we talk about the importance of prevention and maintenance, and how once you get the products that work for you, once you get the routine that works for you, you just stick with it. And so, yeah, if you're using a system like Phyla or using a wash, a product that you like, ideally you're sticking with it and you're continuing, even when you're doing well. Maybe you miss a day here or there, but for the best result, you stay on your treatment over time.
Yeah, and it's so important, because I think compliance is an issue, but then also completing your course of treatment is really, really important. And that's why I think Phyla can help, because Phyla is designed to be very mild and have no side effects. And unfortunately, some people stop complying because the product is harsh, and their skin can't take it anymore. And that's understandable. There's obviously other reasons for non-compliance too, but this is actually because you understand that when a person is concerned about their acne, they're coming to a provider and getting professional help. They're motivated, right? Mm-hmm. No one's dragging them there. And then it's really, really important that we then make it easy with the use of products that work well with their skin. And the beauty of Phyla is, because you apply the phages over and over again on your skin, you're giving your skin the chance to absorb it, and for the phages to engraft in your microbiome. Because long term, we want the phages to naturally live on your skin, just like they live on the skin of healthy people for decades and decades and decades, right? And so that's kind of the point of using Phyla long term as a maintenance or a management product.
Yeah, it's cool how it can actually change the skin's makeup over time. That's definitely something I'll educate on more. Thank you for explaining that.
Yeah. Well, that's all I have. Thank you so much, Savanna, for being here and sharing your knowledge. It's hugely helpful. And I really appreciate your time.
Thank you so much for having me.
All right, everyone. Until next time, I will say goodbye.